Ever feel that, that lingering dizziness or maybe just being a bit unsteady after a neck injury, even when the main pain is long gone? Or maybe you know someone who's talked about that.
Yeah, it's actually a really common thing people experience and often super frustrating.
Totally. And that's exactly what we're going deep on today, this link between neck issues, especially, say, after whiplash, and these persistent problems with dizziness, balance.
Exactly. We've dug into some really interesting research trying to shed some light on why this actually happens.
Yeah, for this deep dive, we pulled together info from, let's see, a big study in BMC musculoskeletal disorders, another one, a prospective study from the European Journal of Neurology, and a really useful clinical commentary from the Journal of Orthopedic and Sports Physical Therapy.
Right. And we also looked at some case studies from manual therapy just to see how this stuff plays out with, actual patients.
So the mission today really is for you listening to get a handle on what's driving this long-term dizziness after a neck injury.
Yeah, we want to go beyond just the initial hit and explore why it hangs around and, crucially, what might help.
Okay, let's dive in. So just how common is this persistent dizziness after something like whiplash? Because it must feel pretty isolating if it's happening to you.
That's a really good point. And that BMC study really drives home that it's far from isolating. They found, get this, 63% of people still dealing with whiplash-associated disorder, or WAD.
63%. Wow.
Yeah, 63% reported dizziness a full year after their injury. And this was even after they'd gone through exercise programs meant to help.
A year later, even with rehab. That
Yeah.
really tells you how stubborn this can be.
Yeah.
It's clearly not just, a little thing that fades with the initial soreness.
Precisely. The research pretty consistently shows dizziness is a really frequent complaint in chronic WAD. It pops up early and, it can stick around even after exercise.
And this isn't just a mild, oh, I feel a bit off kind of thing either, is it? The study sort of put the intensity into context.
Yes, they did. Now, they noted it wasn't typically like room-spinning vertigo like you might get with Meniere's disease or something.
Okay.
But the level was still clinically relevant. And interestingly, the average intensity reported was actually higher than what people tend to report 6 months after, say, a sudden loss of vestibular function.
Huh. So even if it's not that extreme spinning, it's still a major bother for a lot of people after whiplash. Okay. So it's common, it's bothersome, but what's actually going on? What's the connection? Neck injury, dizziness, how?
Right. This is where it gets fascinating. It comes down to the role of your cervical spine, your neck, and something called sensory motor control.
Sensory motor control.
Yeah.
Okay.
There's a great commentary in the JOSPT that explains it really well. It's basically how your body takes in all the sensory information, coordinates that with your motor output, your movements, and processes it all centrally in the brain and spinal cord to, keep you stable.
Okay, like the body's internal GPS and stabilization system working together.
Exactly. And the really unique thing is the neck's direct connection to your balance and vision systems. It's different from other parts of the spine in that way.
Direct connection.
How so? It has direct neurological links to the vestibular system, that's your inner ear balance center. Absolutely key for knowing where you are in space. And it also strongly influences how your visual system works.
Ah, so mess with the neck and you can directly mess with balance and vision signals. Makes sense.
Precisely. So when you have a neck injury like whiplash, it can cause altered sensory input. We call it afferent input coming from the neck.
A fan, so signals go into the brain.
Exactly. Think of it like the constant data stream from neck muscles and joints telling your brain about head position, movement. If that data gets corrupted or fuzzy,
Then the brain gets bad info, leading to dizziness, feeling unsteady, maybe even visual weirdness.
that's it exactly. Dizziness, unsteadiness, visual disturbances can all stem from that altered afferent input.
And what specifically causes that input to get altered after whiplash?
Well, the BMC paper pointed to a couple of main culprits. One is functional impairment of the neck muscles themselves.
Okay.
So this could be altered neuromotor control muscles, not firing right, not coordinating smoothly, or they might get fatigued much more easily, increased fatigability.
Right. Tired, poorly controlled muscles sending wonky signal.
Exactly. And the other big factor, just pain itself. Pain signals can actually interfere with sensory processing at various levels in the nervous system.
That makes total sense. Constant pain signals could easily scramble the other messages trying to get through. Didn't the commentary mention experiments on healthy people?
Yeah.
showing this effect?
Yes, it did. Really interesting stuff. They pointed out that even if you take someone with a perfectly healthy neck and you artificially mess with the sensory input from it,
How do they do that?
things like applying vibration to the neck muscles or putting them in a really restrictive neck brace, or even just having them do sustained isometric contractions, like tensing the neck muscles hard for a while,
Yeah.
all of those things have been shown to affect balance and eye movements in healthy folks.
Wow. So even a temporary disruption throws things off.
Hmm.
And was there something about the upper neck being particularly important?
That's right. The upper cervical spine, the very top part near your skull, is packed really densely with these sensory receptors.
Ah, more sensors up there.
Exactly. So because it provides so much sensory information, the thinking is it likely has a greater influence on both balance and vision compared to the lower parts of the neck.
Okay, that paints a much clearer picture of the why. Now, what about predicting who gets this long-term dizziness? Are there clues that suggest someone's more likely to struggle with it after whiplash?
Yeah, the BMC study looked exactly at that. They followed people for 12 months and tried to see what factors were linked with still having dizziness at that
What
point.
did they find?
They found that the people still reporting dizziness generally did worse on balance tests, specifically something called the Sharpen-Romberg test.
Sharpened Romberg.
Yeah.
What's that involve?
It's where you stand heel to toe, like on a balance beam.
Yeah.
And then you close your eyes, really challenges your balance system. And yeah, those with persistent dizziness found that significantly harder.
Makes sense. If your balance is still shaky a year out, dizziness is likely part of that picture. What else?
They also found those folks had reduced neck muscle endurance, NME, they call it.
Right, the muscles tire out faster.
Yep. Also, more limited neck range of motion, higher levels of pain, higher scores on the Neck Disability Index. It's a common questionnaire.
Uh-huh.
And generally reported poorer psychological well-being and quality of life compared to the folks who weren't dizzy anymore.
So it really sounds like the dizziness is often tangled up with a whole cluster of ongoing issues.
It really does.
Yeah.
And here's a really interesting finding. How much people improved on that Neck Disability Index and on their neck flexor muscle endurance specifically.
The muscles at the front of the neck.
Yes. How much those improved from the start of the study to the 12-month mark was related to whether they still had dizziness.
Ah, so even if they were doing exercises, if they weren't making good gains in neck function, specifically disability and flexor endurance, the dizziness was more likely to stick around. That's key.
It really is. And when they crunched all the numbers in a statistical model, those two factors, change in NDI and change in NME flexors, were significantly linked to dizziness at 12 months.
Okay.
Along with some baseline factors like age, how bad the dizziness was initially, and their starting NDI score, those things explained about half the reason why some people were still dizzy a year later.
50% explained. That's pretty substantial. Now, what about the type of exercise? Did it matter if they did neck-specific stuff versus just general activity?
That was one of the surprising findings, actually. No, the study found that whether people did neck-specific exercises or more general physical activity didn't predict who would still be dizzy at 12 months.
Huh. That's really counterintuitive, isn't it?
Oh.
So it's less about what exercise you do and maybe more about achieving specific functional improvements, like that endurance and disability score.
That seems to be what the data suggests, yeah. It's about the outcome of the exercise on those key neck functions, perhaps, rather than the specific exercise prescription itself.
Interesting. Okay, let's shift focus a bit to the actual movement of the neck. Range of motion. Does whiplash usually cause long-term stiffness for most people?
Good question. The study in the European Journal of Neurology tackled that directly. They found, okay, right after the whiplash injury, yes, definitely significantly less neck movement in all directions compared to a control group who'd sprained their ankles.
Makes sense. You'd expect that initially.
For sure. But the key finding was, by the 3-month mark, neck mobility in the whiplash group looked pretty similar to the ankle sprain group.
Oh, really? So it tends to recover for most.
It suggests that, yeah, for the majority, whiplash doesn't seem to lead to major, long-lasting restrictions in how far they can move their neck.
That's actually kind of reassuring. Initial stiffness is bad, but it doesn't necessarily mean permanent restriction for most. Did that study find any other links, though?
It did. Among the whiplash patients, they saw an inverse relationship between neck pain and headache levels and their neck mobility at that 3-month point.
Inverse relationship,
Yeah,
meaning more pain, less movement.
Exactly. Those reporting more neck pain and headaches tended to have less range of motion, which, makes intuitive sense. If it hurts, you probably don't move it as much.
Right. And did the severity of the crash itself matter for long-term movement?
Yeah.
Like a bigger impact means more stiffness later.
Well, that paper actually cited an older study that looked at collision forces, and that study found something interesting. Well, maybe the initial pain level might relate to the speed difference in the crash.
Uh-huh.
The actual severity of the collision force didn't really correlate well with long-term pain or ongoing neck restriction down the line.
Wow. So a little fender bender could potentially cause more lasting problems for someone than a bigger crash for someone else.
It seems possible, yeah.
Yeah,
It really highlights how complex whiplash is, and that it's not just about the physics of the impact.
definitely underscores that. Many factors seem to influence the long-term outcome.
Exactly.
Okay, so neck mobility might recover for many, but we keep coming back to these sensoromotor issues driving dizziness. Let's unpack those specific deficits a bit more. What do they actually look like?
Okay, yeah. Drawing from that JOSPT commentary and the case studies in manual therapy, we see some recurring themes in people with neck pain, especially those with dizziness. A big one is disturbed head-neck awareness.
Head-neck awareness.
Yeah, basically impaired cervical position sense, knowing where your head is in space without looking.
How do you even test that?
A common way is using a laser pointer attached to a headband.
Okay, laser pointer.
Patient sits facing a target, closes their eyes, moves their head away, and then tries to put it back to the exact starting spot. You measure how far off they are. People with neck pain often have bigger errors. They're less accurate.
So their internal sense of head position is off. Fascinating. What else?
Another common one is disturbed neck movement control. Their movements might look kind of jerky or not smooth.
All right, less fluid.
Yeah, and patients might even say their head feels heavy or just difficult to control smoothly.
That sounds really unsettling.
It can be. Then there's postural instability balance problems. Now, it's worth noting these balance issues are often more subtle than in someone with, say, a primary inner ear problem.
So not necessarily falling, but just feeling wobbly, unsteady.
Exactly, a general sense of being off-kilter. And finally, oculomotor control issues. Problems with eye movements.
Eye movements. How does the neck affect that?
Remember those direct connections? It can show up as altered smooth pursuit trouble, smoothly tracking a moving target with your eyes, or issues with saccades, those quick jumps your eyes make between targets, and also changes in the cervico-ocular reflex.
Cervico-ocular.
Yeah.
That's the reflex coordinating head and eye movements to keep vision stable when you move your head.
That's the one. Crucial for clear vision during movement. The commentary mentioned the smooth pursuit neck torsion test, basically seeing how neck rotation affects eye tracking ability.
Okay, so it's a whole system issue neck injury, affecting the coordination between neck, eyes, and balance. And the case study showed people can have different mixes of these problems.
Absolutely. That's what the manual therapy cases illustrated so well. You might see someone with acute whiplash where pain limits testing initially, but the sensoromotor stuff becomes clearer later. Or people with chronic neck pain, even one case without much dizziness, still showed distinct patterns of these sensoromotor deficits. Everyone's a bit different.
Right. So if these are the problems, what's the fix? How do you manage this? How do you retrain that control?
Well, the key takeaway from the commentary and the case studies is you need an approach that tackles both the local neck stuff and those links, neck, vestibular, vision. It usually involves what they call tailored sensoromotor control programs.
Tailored, meaning specific to that person's deficit.
Exactly. So if their position sense is off, you do exercises for that, maybe using that laser pointer again for feedback. Gaze stability exercises are huge learning to keep focus on a target while moving your head. Eye-head coordination drills to get those working together smoothly again. And of course, balance training.
Making the balance progressively harder.
Yep. Different stances, feet together, one foot, etc. Different surfaces, foam pads, wobble boards. You systematically challenge and retrain that postural control.
And the manual therapy paper actually gave examples of these exercises.
It did, yeah. Tables 1 and 3 in that paper lay out some really good examples how you might start with, say, head repositioning using the laser with eyes open, then progress to eyes closed, or relocating to different points in their range. It shows that progression clearly.
Makes sense. So it's not just generic neck stretches, it's very targeted retraining of these specific skills.
Absolutely, and gradual progression is crucial. You can't push too hard, too fast, especially early on. You have to constantly monitor symptoms, pain, headache, dizziness, and adjust accordingly.
And it's probably not just exercise, is it? The commentary hinted at a broader approach.
That's right. Often, a multimodal approach works best, so that might include manual therapy, hands-on techniques for joints and muscles. Pain management strategies are important, and addressing psychological factors like stress or anxiety, which can definitely impact chronic pain and dizziness.
Right.
The case studies also show that, in the acute phase, pain might really limit where you can even start with the sensor-motor exercises. You have to manage that first sometimes.
It really paints a picture of a comprehensive whole-person approach.
Okay.
Okay, this has been incredibly insightful. Let's try and wrap this up for everyone listening. What are the absolute key takeaways about this persistent dizziness after neck injuries?
Okay, the main things are: 1, persistent dizziness after neck injury, especially whiplash, is really quite common. Don't feel isolated if that's you. 2, it's very likely linked to messed up sensoromotor control. That communication pathway between your neck, your balance system, and your vision system gets disrupted.
Yeah.
3, while your actual neck stiffness might get better over time for many people, underlying problems with muscle function, proprioception, that body position sync,
Yeah, proprioception.
and overall coordination can keep causing dizziness and balance issues.
And crucially, just doing general exercise might not be enough.
That seems to be the case. It points towards needing a more comprehensive approach, one that doesn't just chase the pain, but actively assesses and treats these specific sensorimotor deficits with tailored rehab programs. That seems to hold the most promise.
This really has been fascinating. And thinking about this incredibly tight link between the neck and balance, it does make you wonder, doesn't it? What other subtle ways might injuries in one spot affect seemingly unrelated functions elsewhere in the body? Maybe digging deeper into that whole concept of proprioception could unlock even more understanding about these connections. Definitely food for thought. Thanks for joining us for this deep dive.